Good evening. Thank you so much for watching HealthLine on PBS Fort Wayne. I'm your host, Mark Evans. A very, very important topic, and of course I think I say that every time I do a show, but we always try to do important topics. We're going to talk about the kids tonight, and we're going to talk about when to worry about childhood anxiety. And we have a very special guest, and she's been on the show before. She's a pediatric psychologist. It's Dr. Rachel Lilly. Nice to have you.
Thank you. Nice to be here.
Thank you so much for being here. We were in the green room before the show, and we were talking about what we're going to talk about on the show, and I'm thinking this is going to be excellent. And we really need some audience participation. That's what this show is all about. We want to help you help yourself and others. So if you stick around for at least a few minutes, you might learn something. Or you might want to get on the phone right now and say, hey, so-and-so, they're doing a show about kids' anxiety. It's rather common these days. The number on the screen is what you need to call, 866-969-2720. It is public television. We don't stop down for commercials, so we have a whole half hour to take your calls. So start calling those in now, and we're going to go ahead and get started with Dr. Lilly. So the things you'd like to talk about tonight is normalizing worry and natural responses, coping and basic cognitive strategies, and also signs that further help may be needed. And I think with this outline of this program, we're going to tackle those things. So I'd like to know right off the bat, how many children in the U.S., if there's an estimate, are affected by severe anxieties?
Affected is one thing, right? Like, I think throughout childhood, we all feel anxiety to some degree or another. Diagnosable, clinically significant, somewhere 10, 15%, somewhere in that range, are usually diagnosed or can be diagnosed with anxiety at some point.
And it was an interesting thing that we talked about before the show is like anxiety is not all a bad thing. It's all part of life. In fact, some anxiety is actually healthy. Can you go on about that?
Definitely. At its core, anxiety is adaptive. It is a helpful emotion, a helpful feeling that we all get to feel at some point. It's not necessarily something we enjoy feeling, right? Doesn't feel good to feel anxious, but it's a helpful emotion, just as all of our emotions in some capacity or another are helpful and adaptive. So yeah, if we think about anxiety kind of on an arch, right? So feeling no anxiety, that can be problematic in and of itself. If you think in the world of kids, if we're talking about just test anxiety, something that a lot of people experience. If I feel no test anxiety, who cares, right? I'm not going to study.
And
I'm
that's
not going to try my best. That's not good. No, that has its own issues. Then there's kind of that healthy level of anxiety. It's helpful. It motivates me to study. It motivates me to try my best and try my hardest. And then we can tip into the level of anxiety where we enter that fight or flight or freeze mode, right? And we become so overwhelmed that then we cannot perform to our best ability. So there's kind of this, like I said, this range, and a little bit of anxiety is not a bad thing.
Okay, but is there a difference between the things that kids worry about versus adults?
To some degree, yes. So there are certainly elements that we see, or diagnoses, or just concerns that we see more often in kids, separation anxiety being one of those. I just mentioned test anxiety. I'm not taking a whole lot of tests anymore at my age, so it's not something that comes up a lot. And then we can also see the social anxiety piece of things. Certainly adults can experience social anxiety. We do often see it a little bit heightened in our teenagers. It's part of their developmental stage that they're going through. They care a lot about what peers think, what their social circle thinks. So we can see it at different rates, but yes, there are some differences.
How has social media affected our children today?
In so many ways, kind of going back to that social anxiety piece, right? If you think about, I don't know, when I was in high school, we didn't really have social media. I got to go home and I was home. I wasn't on my phone. I had to log in through like dial-up to get in any contact with friends. Versus now we pull out our phone, and if we think about anxiety being adaptive, right? Our ancestors used to compare themselves to smaller groups of people, right? Am I doing what I need to do to fit in with this group? Am I gonna get excluded if I do something wrong? That's adaptive, right? It helps us maintain our social circle. Now our kids and us, we're we're expanding to the world, right? I have the world in my hand. And so I'm not just comparing myself to the people who live nearby. I'm comparing myself to someone on the other side of the world. What do they have? What do they look like? How are they dressing? And so that can really ramp up anxiety.
So you would agree then, maybe in the last, 10, 20 years, anxiety among children has increased?
I don't have the data, the numbers off the top of my head, but yes, social anxiety, and we know that the impact that social media is playing, especially on our teenagers, in that anxiety. So yes.
Well, and may I ask this, a little sidebar. You're a parent, and you've got two and
one on the way. Yes.
So, and you mentioned that you have a boy, a girl, and the one you're going to have is a girl. I'm trying to figure out how the best way to ask this. Do they all share, or the two that you have now, are you seeing similarities as far as anxieties? Are they just two different people and they have their own set of anxieties?
They are two different people with their own set, for the same parents, the same home. Now they have different life circumstances, different situations, but yes, they definitely, and they experience anxiety differently, but they're also very different ages. They're only a couple years apart, but right now our son is a 5-year-old getting ready to head into kindergarten. He's thinking and reasoning, and what if this, what if that? Versus our daughter is 2. And so there's a little bit more of that separation anxiety, things like that. So just developmentally differently, but also their personalities are quite different.
I see. So it depends on personalities.
It definitely plays a role.
Okay. And what is the difference between the normal anxiety and the severe anxiety that is going to need treatment? So what is the breaking point? What's the brink?
So it kind of depends, as with all things in mental and behavioral health, but usually my threshold is when does this turn into a diagnosable, something that's needing treatment, is when it really impacts our day-to-day lives and our day-to-day functioning. And so usually we look at what we call our ADLs, or our activities of daily living, right? Is anxiety getting in the way of my sleep? Is it impacting my appetite? Is it impacting my engagement with friends and my social circle? Am I refusing to go to school? Are my grades decreasing? So it's when we're seeing this impact on our ability to function in our daily world.
My mother used to call it stages or phases, adolescence, and those are certainly going, as you get older and you're a teenager, I'm sure the adolescence anxieties are a little bit different than much younger children. Am I correct?
Yes.
And do they seem to get worse? Because it seems like life gets more complicated the older you become.
It does, and when we're 3, that anxiety feels really big to us at that stage.
Yeah.
When I'm 5, my anxiety feels really big because that's my world, that's my cognitive ability, my cognitive capacity. But yeah, so we can see it ebb and flow, and like you said, everything is a stage of life, and we're also impacted not just by our internal states, but by everything that's happening in the world around us, in our family, in our life situations. But yeah, we can have more of a predisposition towards an anxious temperament. Yeah.
Well, how do you tell, though, it's not just necessarily a stage or a phase, but there's definitely some issues there that we need some extra help on? When do you identify that?
So a lot of times it's when it becomes a pattern, right? It's not just, I know a lot of students are going through state testing right now. That's an anxiety-provoking situation, right? I might lose some sleep over taking a test. I might have a decreased appetite. I might feel a little bit sick to my tummy. The start of school, also a time that can increase anxiety levels in kids. Yeah. And so if we get through this little phase, this stage, and okay, we made it through and we've kind of adapted, we're doing okay, then I'm not sure we necessarily need any further treatment or help. It's when that concern persists and it becomes a pattern. When I'm discharging patients who I work with and I'm saying, I'm not sure we need to meet anymore, we're doing okay, that's usually one of the caveats that I give is, when is it time to come back? When do you need to seek help again? Is when it becomes a pattern. It's not, I had a really anxious day, or I felt a lot of anxiety today. No, that's part of being a human. It's when that becomes a pattern and it starts to interfere.
Yeah. There are some common anxiety disorders that children and adults deal with. Can you tell us about those and
Definitely.
explain what they are?
Yeah, so I mean, kind of our first big one is generalized anxiety disorder, or GAD. Sometimes it's seen.
And is that a wide spectrum there?
It is exactly what it sounds like. It's
Yeah.
generalized.
Okay.
It's not just about one thing or another. It's generalized. There's a lot of worry, and again, having that impact. Social anxiety disorder, another one. Again, pretty much what it sounds like. There's that fear, or that fear of being judged, that social piece. There can be some performance anxiety as well. That's where test anxiety can sometimes fall into if there's a fear of being judged on our performance. We can look at panic disorder, which are more of those panic attacks. We can see those. And then there's also a fear of having a panic attack. Let's see, and then there's a lot of specific phobias, which are those fears of specific situations, specific triggers. So, I mean, agoraphobia is a fear of leaving the home or being out in a public place. So those are the kind of the big across the lifespan. We can also see separation anxiety disorder in younger children. We can see it in anybody, but we see it more often in younger children, which is an anxiety about separating from that a caregiver.
Agoraphobic?
Yes.
Didn't that, not to get off the subject too much, but it seems like that popped up a lot more during and after COVID.
Again, I don't have data. It feels like it. I mean, we were all isolated and staying by ourselves. And if I don't have to leave the home to go get groceries, or at the time we were like, if I can't leave the home, right? But if I'm not leaving the home to go get groceries, and then, okay, I don't have to, I'm not worried about being judged as much. There isn't that fear of that social situation that can be reinforcing. And so then it's easier, I don't know if easier is the right way, but we fall more into that pattern of staying.
Well, a former significant other of mine went through that. She was very outgoing before COVID hit, and then as things changed, she just didn't want to go out anymore, just wanted to stay home. And I have a sister, bless her heart, is the same way. And she's actually seeking help as I speak. But I just found that very, very interesting. It just seemed to be brought on so many other things other than what we just discussed. Right. You touched on this, but the next question is, when should parents really worry about a child's anxiety, and what are the signs, the clear signs that they need help?
So in our young kids, sometimes they don't even have the words to be able to say, I'm feeling anxious, this is worry, right? Oftentimes we see it come out in physical symptoms. Belly aches are a big one, headaches, feeling shaky. And it's not, and I like to emphasize to parents who I work with, it's not that they're not feeling belly aches, right? It's not that they're making it up or that they're not experiencing that. Their stomach is truly hurting. It is not feeling good, but that's how it's manifesting. So if we're seeing a lot of physical symptoms, you've gone to the doctor, the pediatrician, and they've said, we're really not seeing any like physical reason for it, might not be a bad idea to consider anxiety.
Okay. If you're joining us now, we're talking about a very serious situation and issue going on right now in our human lives, I guess, or in society. We're talking about childhood anxiety, and much of it can be very severe. And so if you have questions about that, please give us a call, 866-969-2720, and Dr. Lilly will answer those. So we talked about when they should worry about the child's anxiety and the signs that they need the help. What happens and what are the effects or risks of an anxiety problem that isn't diagnosed and treated?
So, I mean, first and foremost, it's not a comfortable feeling, right? Feeling anxiety, like I said, it's a normal human emotion. It is a normal adaptive thing that we all get to feel. But it's also really uncomfortable. And if this is pervasive and we're having this across different contexts, it's impacting our daily lives, well, that's going to be a big impact. I may not want to go out for my T-ball team, or I may have a really hard time going to school. Grades may start to dip if I'm constantly worrying, oh, what if that person's thinking of me? Right? If I'm thinking and worrying constantly. So we can see an impact on our lives, and we can also see an impact on our health as well.
And what about mental health, long term? I mean, can some of these things actually affect you mentally even worse down the road if they're not treated?
Well, like what we just spoke about with the agoraphobia piece, we can definitely see an impact. And not saying that everybody who experiences anxiety will have agoraphobia, and it's we can see that piece. It's helpful. It's why I like to really intervene in the pediatric world. That's where I specialize, just because when we treat young, we give kids or adolescents coping strategies, ways to think about things, then they can use those as they get older and hopefully prevent some of the more pervasive, more debilitating anxiety.
Well, we certainly hope so. But, they got to get the help. And the parents need to identify that and not just slough it off as, oh, it's just a phase. I mean, it could be. But again, as you said, if those symptoms tend to get worse and they're really obsessing on it, well, then we got to do something about this. Kids shouldn't have to deal with that. Well, adults either, but especially poor kids, So I'd like to get into the treatment. I know there's several ways to treat this, and of course you're a psychologist and you can't prescribe medications. And so medications can help, but as a psychologist, how would you treat a child with severe anxiety?
Definitely, and it's definitely multifaceted, and it depends on those diagnoses that we talked about before. It also depends on a child's cognitive level, their developmental level. A key piece a lot of the time is teaching coping strategies, teaching ways, again, when we're in that fight, flight, or freeze mode, how can I bring my hyperarousal down a little bit? Deep breathing, progressive muscle relaxation, squeezing and relaxing our muscles, using what we call grounding techniques. So a really simple one is find 5 things you can see, 4 things you can hear, 3 different textures that you can touch, 2 things you can smell, and 1 thing that you can taste. And that brings a child a human being, not just a child, back to the here and now, back to the present moment. So really working, teaching, practicing those coping strategies is a big starting point. We can move into cognitive strategies, so cognitive restructuring, taking a look at how we think about the things that come up. Am I having a lot of these what if thoughts? How do I challenge those? How do I talk back to some of those? And then ultimately, with a lot of our anxieties, we move into what we call exposure. And so this is really putting ourselves or the person experiencing anxiety into some of those feared situations. Sometimes I'll use a metaphor with families of diving into a really cold swimming pool. So we're getting into summer mode. Pools are probably a little bit cold right now, but if I go up to a really cold swimming pool and I stick my toe in and I think, oh, that's too cold, I'm not getting in that, and I go sit back on the sideline. A few minutes later I go up and I stick my toe in, oh no, I'm not doing that. That's not gonna be comfortable. I'm never gonna get in the pool. But if I go up to the pool and I think, okay, it's gonna be uncomfortable for a little bit, and I jump in. At first it's shocking, at first it's uncomfortable, at first I don't like that feeling. But what happens if we stay in the pool for a while, right? We start enjoying things, we play around with our friends, we get used to it. Every once in a while we might stop and think, yeah, it's a little bit cold, but we're in the pool and we're enjoying it. And anxiety is the same kind of way a lot of the times. We're gonna dive in, we're gonna try that thing that scares us, try that thing that makes us feel anxious. And eventually our body, we can't stay in fight, flight, or freeze for forever. Eventually we start to get used to it and realize, okay, this isn't as bad as those what ifs, those feared thoughts that I was having.
Well, and I'm going to tell you a little story. It's a true story. I did a show for, not a show, but actually a story from Canada, the CN Tower. At one time it was the largest structure in the world. And it's so tall, I can't tell you how tall it is, but I do have a fear of heights. And I'm typically grounded. Okay, I'm usually on the ground. If I get on a tall ladder, it's like, I've always been that way. I've even been hypnotized before to go on a roller coaster. It didn't work, but I tried. But I was so fearful, because they have a glass floor. You can actually walk across this glass floor and see 1,000 feet down. And I was so petrified, I was actually crawling. I was on my hands and knees. This is live TV, by the way. I was working for another TV station in town at that time. I was very embarrassed about that. But I got up there and I just totally just lost it because I hadn't had a chance to acclimate to that. And I don't know what would have helped, maybe just in town going to like the Lincoln Tower, maybe going up there at the top and just getting used to that. And I've been up there before and it was, that was scary enough for me. But I wish I would have had maybe some of that help before I would have done that story because it did not go well for me.
But that's exactly that's a gradual exposure, right? Maybe we might imagine ourselves on this big tower first, and then we might watch a video of it, and then we might go up to the top of, I don't know, I'm trying to think of a smaller building and I'm blanking, but we gradually step our way. We're not going automatically to that top. And so we get used to it and we start to think, hang on, I did that. I can do this next thing.
Yeah, it was too much. I mean, it was a great visualization. The camera shooting down, you could just see it. It's like, oh, but you know, my thoughts were, what if this glass breaks? You know,
there's your what if thought right there.
That's the what if. Yeah. So, but there are various ways, and it's kind of a personal thing, right, on how we handle those phobias. Yeah, I think it's a very personal thing. Let me ask you this: when you are dealing with these children, do you deal with them by themselves or with the parents or a little bit of both?
A little bit of both usually. Again, it kind of depends. It depends on a child's insight into their triggers and their ability to cope. Usually when we're doing some sort of exposure therapy like that, I do like to bring a parent in or a trusted other person just to help them stay accountable to be able to do that. But the coping, the cognitive strategies, the cognitive restructuring, that kind of depends on, again, age of the child, developmental level, and where they're at on that journey.
Now, and you can't speak a whole lot about this, but these children or people in general, they do the CBT, the cognitive behavioral therapy, and the exposure therapy, as you explained. Sometimes medications are needed to help. And of course, you would have to refer someone to maybe a psychiatrist?
So it would depend. Yes,
Okay.
Psychiatry would be one who would be able to address anxiety concerns with medication management. A lot of the times primary care providers, pediatricians, family med providers can also help with that. So usually I say start with your family med provider or your child's pediatrician and see where they're at. Usually conjunction with therapy is most helpful. But yes, so psychiatry or a family medicine or pediatrician.
I mean, it would be great if they didn't have to have medications. It'd be great if you could just kind of talk it out and do the exposure thing and so forth. So, and you touched on this lightly, but seriously, if you have a child, and I'm speaking, you know, if I were a parent and have a child who is dealing with these things and you're very concerned about them and you have a pattern going, as you mentioned earlier in the program, what is your first step? What do you need to do to get this child help?
First of all, I would acknowledge what the child's feeling rather than, oh, you're fine, your stomach is fine, don't worry about it. Just, right, it's okay to acknowledge it and say, whoa, I think you might be feeling a little anxious, or if that's a big word, sounds like you're pretty worried about whatever is going on, riding the school bus to school. So first acknowledging it, helping give your child the language to be able to say, oh, that's what this is feeling, right? Just that simple acknowledgement that what I'm feeling is not just in my head. It's a real, true feeling. To normalize it. Oh, I feel that way sometimes too. We all feel anxiety sometimes. Again, we're not dismissing it like, oh, we all feel that way sometimes. But no, like, oh, I feel that way sometimes too, and it's a really hard feeling. What would you think about talking to someone about it? And then kind of give it up. It, again, depends on the child's developmental level. A 3-year-old is probably not going to say like, okay, let's go get some therapy. But a teenager may say, yeah, you know what, I do think I need to talk to somebody.
Okay.
And then from there, it's seeking help. You can call your insurance card, see what licensed therapists are available locally. There's some websites that you can search. And honestly, like I said, usually I say talk to your pediatrician, talk to your family med provider. Usually they have a list of starting points for resources.
All right. Well, Dr. Lilly, we have about 30 seconds left, and I would like for you just to have the floor for a moment and for our viewers, just to give them some comfort if they have a child who's going through this. What should they know?
It's normal, right? It is a normal stage of development. It is a normal human emotion that, again, we all get to feel. And so just that normalizing, sometimes we can start to feel anxious about our anxiety or anxiety about our child's anxiety, and just to pause and say, okay, this is a normal thing, and there's a lot of things that we can do to help. There are a lot of resources, and there's hope. There are things that we can do.
And if you have to, take him to the family physician and go from there.
Exactly.
And maybe they get to see somebody like you.
Exactly.
All right. Thank you so much for being here.
Thank you.
And talking about this very important topic. We thank you for watching, and we will see you next Tuesday with another topic. Until then, good night and good health.
PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.